Hi, I'm Dr. Bonner. I'm a physical medicine and rehabilitation as well as a pain medicine specialist here at Proform MD in Miami. Not every patient with low back pain experiences leg pain. Some of those patients will just have pain that stays in the low back. Very commonly, one of the sources of that type of pain can be the lumbar facet joints. These are the joints that are paired at each level of the spine, really all the way up to the cervical spine. But in the lumbar spine, we know them to be a source of pain, especially in the older population. These joints have hyaline cartilage just like your knees, your shoulders, and hips, and can develop arthritis just like those other joints. When they develop arthritis, they can become painful. And how do we treat that pain? Most commonly, we treat it with physical therapy and medications, but we can also treat it with interventions. As pain physicians, we used to do lots of intra-articular injections, so putting a needle into these joints using X-ray guidance and injecting medication into those joints, specifically a cortisone type medication. We found those injections weren't very helpful long-term. They may have provided some short-term relief, but we needed a different treatment to make the relief last longer. In the process of trying to figure out a longer-term treatment for this problem, it was discovered that there's a small nerve called the medial branch that travels in this area here and carries the signal of pain from one of those joints. We now have a procedure called radiofrequency ablation, which uses a special needle that heats up at the tip to burn that tiny nerve and make the signal of pain go away for up to a year or sometimes even longer. This procedure is backed by significant research and is very beneficial for patients with pain related to the facet joints. Usually this procedure is done as a series of 3 procedures, where the first 1 or 2 injections will be just diagnostic procedures, so just an injection of lidocaine or other local anesthetic around those nerves to see if the pain can be relieved. If the pain can be relieved, then you proceed to have the radiofrequency ablation procedure done. If the pain is not relieved by the local anesthetic block, then there's no reason to move on to doing the radiofrequency ablation procedure.